So they're two very different things, in my opinion. We have the 12-step program and the community of 12-step and AA that encompasses the clinical work that we do. So the way I look at it is, they kind of run parallel to one another. They are complementary to one another. So in order for us to do the clinical work that we want to do, which is to get into the underlying issues, why someone is reaching out for substances, that's just one way that people deal and cope with, trauma or hardship or distressing feelings or emotions that they just can't handle, emptiness, sadness, anger, resentment, all of those things. You reach out for something to make you feel whole, right? So on the clinical side of things, we try to figure out what's going on underneath, the underlying issues of those feelings. And we dig around and we try to get people to kind of face their trauma, face that empty feeling, face those feelings of rejection or abandonment or resentment that they're having. And we do that in a clinical way by talking about the actual issues that occurred. The 12-step program is this wonderful containment piece that we get to have here at Oak Forest. So we've taken away their ability to cope with the thing that they want to use to cope with those feelings most of all. And we're talking about those horrible, terrible feelings underneath it all. And then they leave their session, they leave the group, they leave the conversation that they had with one of their case managers, and now they're surrounded by this 12-step community that can contain them. It gives them another tool. It's another way for them to manage those feelings. So they complement each other in that way. You get out of a session. I can't tell you how many times someone's come out of a really deep session, an EMDR session or a really strong therapy session, and they walk out into their group, they walk out into their peers, and they say, I'm really struggling. I just had a really gnarly session. And everyone around you is part of your peer group, first of all, in the treatment center, but they're also a part of this greater community of 12-step. So then you go home and you're surrounded by that 12-step community, and did you call your sponsor? What step are you on? Let's talk about it. There's a communication there in a way that they understand each other within the 12-step community that is very different from a clinical community or support. Does that make sense? So you're completely surrounded. It's like this 360, kind of circle around the client. And, when things come up with step work or within their kind of work that they're doing in the AA community, go talk to your therapist about that. Something comes up about my dad, or something comes up about a sister I lost. Go talk about that with your therapist. So the 12-step community also has us as the therapist and the clinical side to help them. Oh, that's a big, deep, dark issue that I'm not really sure how to deal with. Go talk to your therapist about that. So that's kind of how they help each other out.